All right, and lastly, I'm going to palpate Nathan's facial muscles and the anterior neck. I'm gonna start with the SCM. So we know it attaches from the sternocleidomastoid attaches from the mastoid process down into the sternum. So I'm gonna have him flex his head and rotate to the opposite side, and you can see the muscle belly pop out nice and easy there. So whenever I stick in the needle, I'm going to make sure to pull that muscle away just to kind of avoid the jugular and the internal carotid vein with my needle. We can have some of that referral pain into the forehead mostly, as well as the superior head, posterior head, and into that facial and jaw region. So if a patient has TMJ pain, this would be a good thing to look out for. Next, I'm going to do Masseter. So I'm going to come into the zygomatic arch right here in his cheek, have him clench his teeth together. Good. And then with this one, I'm going to make sure to stay more anterior to avoid that parotid gland that is a little bit more posteriorly. So this one can kind of refer into the molars in the back of the teeth and up into the eyebrows as well. And then lastly is the temporalis. So I'm going to go into the temporal fossa, about superior and a little bit anterior to his ear here. Have him clench his teeth again, and I can feel that muscle pop out. I just want to make sure with the needle here to stay a little bit more anteriorly to avoid any vasculature or the nerve that comes up kind of towards the middle of the muscle belly. And with this one, the referral pattern kind of stays to the upper teeth and kind of a fan-like display into the middle of the head, but also behind the eyebrows and the forehead as well. So any patient with TMJ pain, neck pain, I'm going to kind of look at all these muscles to make sure that there's no trigger points there.